I'm going to talk very briefly about health equity accreditation here at RWJBH. I'll discuss about what is health equity accreditation, why do we need to pursue that accreditation, how we're going to do that, and give you some timelines when I believe we'll be able to accomplish some of the accreditation. Before I talk about the health equity accreditation, I think let me first give a definition of health equity and also health disparity, so we can all be on the same page. Health equity is attained when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged because of their social position or socially determined circumstances. Okay. And health disparity, of course, are preventable differences in the burden of disease, injury, and violence, or in opportunities to achieve optimal health. And this is usually experienced by socially disadvantaged racial, ethnic, or communities. Why am I talking about health disparity? Because all what we do in this space is actually to eliminate health disparity. Everybody, ERT, DNI, our social impact, our mission itself is that, to actually eliminate health disparity. Diana, you can go to the next page. So let me talk about health equity accreditation and why I think we should pursue health equity accreditation. What is health equity accreditation? So the NCQA came up with an accreditation for health equity that actually starts in July. This July is when the application starts. So it's right off the bat. We are probably going to be some of the very first organizations to be accredited when we go through with this. And for the accreditation, it has two sets of accreditation. One is the regular health equity accreditation, which is for organizations that are beginning their journey to improve health equity. And also the Health Equity Accreditation Plus, which is for organizations that have implemented the core health equity accreditation, but also include a focus on communities and the social determinants of health. So both of them, these programs will distinguish an organization as a high quality, trusted community partner and with ongoing commitment to health equity. So the two kinds, the regular health equity accreditation and the health equity accreditation plus. What we're talking about here will be the regular health equity accreditation. As we go through that circle, then we'll add a plus, which will involve our social determinants of health and our commitment to improving the communities. Next slide, please.
Thank you, Andrew. Really quickly, if you don't mind, could you explain what the NCQA stands for those who may not know?
It's the National Committees of Quality Assurance.
Right.
Okay.
So, and they are the ones that do the HIDIS, they do a lot of accreditation, and they just come up with this accreditation right now for organizations, health plans, and all that. So now why? Why do we want to pursue the health equity accreditation? If we look at many healthcare organizations, everybody, as Mark alluded to earlier, is operating in the space, every single person. Everybody's trying to figure out how to measure health equity too. So from the US News and World Report that came out with the Health Equity Index, which measures disparities within an organization, to CMS, which has actually just proposed health equity measures to be adopted in hospital inpatient quality reporting programs, and possibly also attaching payment penalties to health equity measures. So you have that. You can go to the next slide. And to even when you look at the Healthy People 2030, the health equity plays a significant, important role in that. And even if you look at Joint Commission, not only having health equity measures as part of its standards, but as partnered with Kaiser Permanente to form an award, Health Equity Award, to recognize organizations that address health disparities. So everybody's working in the space, but I believe that our most important reason why is for us to actually have an outside organization come to us and evaluate us, because we say this is what we're doing, this is our mission, this is what we're told everybody that we're going to do. And accreditation actually will bring the outside organization to look at our books and see, are we really doing what we say we're doing? This is no different from bringing an auditing firm to look at our finances. So we say we're doing health equity, we're saying we're taking care of our communities. This will be a good means of doing that. We can go to the next page. And the Health Equity Accreditation, you know, the process going through will help us reduce disparities, definitely, right? It gives us a framework on what to do. It aligns staff with leadership, especially as we go through the regional model and service line model. It actually shows us, if we look at what we need in Hamilton might be different from what we need in Newark, Beth Israel. But if we have the regional model, we can really do resource assignments appropriately. And also even some, you know, there's talk of insurance companies looking at what people are doing in the health equity space. So this will be a good contract negotiator for us. And also this will make us be recognized in our community as a leader in the health equity space. So we have very good reasons for pursuing the health equity accreditation. We can go to the next slide and I'll explain how we're going to do this. The NCQA proposed about 8 steps that we have to go through to get the accreditation. One is the overview discussion. We've had multiple meetings with the NCQA, and we have purchased, which is the second step. We've looked at the standards and the survey tools, which we're going through now. What we have to do is with the, on the next slide, I'll show you some of the standards. A lot of us in the organization itself are operating in the space. So what I always say this accreditation will do is to force all of us operating in this space to actually carpool, because we're heading in the right direction. So if somebody has, you have HR has to do certain things to help with the accreditation, right? ERT has to do certain things. DNI has to do certain things. This is not going to be an accreditation from one section of the organization. So this will certainly force us all to be heading in the same direction and just carpool instead of everybody working in siloed way. So what we're going through now is looking at the standards and what everybody can own. I have met with Tina's team, the DNI team, and they've looked through the standards. You can go to the next slide, Diana. Through the standards, and everybody can say, okay, this is what I'll be responsible for, or this is, where you can get the data. And this involves, building a diverse staff. We need policies from HR, what HR is saying about that. We need what DNI is doing in that space. We say we're collecting data on language, race, ethnicity, gender identity, sexual orientation. We have privacy protection of this data. This is not new. This is what we say we're doing, right? This is what we tell everybody that we're doing. This is what we promise ourselves internally that we're doing. So this is not too much heavy lifting, but we're bringing somebody outside now to say, okay, this is what you say you're doing. Let us look at your books. Let us actually confirm that you're doing it. That's what the accreditation will do. And next slide is when I think, this is just briefly on the timeline. So what we are planning to do with the application for the Health Equity Accreditation is to roll it out with EPIC for each facility. So the look back period is usually 6 months. So they look at our record 6 months back. So once EPIC rolls out or fill out the application, it takes about 9 months for you to get surveyed. So once it rolls out, we'll go through the process, do gap analysis, and then roll it out. So based on that, I think the best starting point will be RWJ Somerset. They've gone through, EPIC, and then the next phase will be, the facilities that have gone through wave 3. So the University Hospital, Hamilton, and Rahway, and they will determine the time for that. My own personal goal, my own personal challenge is to make sure that one of our facilities is the first to be accredited in the state of New Jersey. So that's we're working with NCQA to see if we can pull that off. I think that would be really, really exciting if we can actually be the first in the state of New Jersey, have a facility. So we're working on that right now, and we're on the path to becoming that if everything goes well. And Yadana, you can go on to the next slide, please. So overall, this is where we are with the journey through health equity, I believe. So exploring, I think from 2016, when we signed the 123 pledge, was when this journey actually, I would say, actually started. So we explored that. And we can see commitment from leadership. We have policies we're implementing. I think what we are working on now is accountability, to see where we're implementing the policies, where we're doing that. So we're in the immersion phase. And then once we go to our farming, and really transforming is when we involve our ecosystem, where we take it outside the hospital. For some things like with Diana, exactly what you're doing in terms of hiring local. And I think that's very transformative. I think we're in the transforming phase on that. But in general, for health equity itself, if we look at it, I think we're in the immersion phase right now. And that is the next slide, I think, is the last slide. Yeah, and that's it. And, we have a very short time, and hopefully I kept to time, Diana. And open to any questions. If we're out of time, we can put chat questions, or somebody can just feel free to email me any particular questions. I look forward to comments or questions. Thank you.